You know, I've met hundreds of patients complaining about sciatica pain over the past 30 years in practice. But the part that sticks with me the most isn't their pain. It's a sentence I hear again and again, Doc. I guess it's just part of getting older. Maybe you've thought that too. That tingling, burning sensation shooting down your leg. The sharp, stabbing pain like pins or electric shocks. One morning you can't stand up straight. One afternoon, you're forced to stop in the middle of the street because your leg just won't move. And you think to yourself, maybe I'm just getting old. But here's the truth. Age is not the main reason. I've seen patients in their 30s and 40s struggling with the exact same pain. And I've also seen 70 and even 75-year-olds walking 3 miles every morning. No back pain. No meds. So, what's really going on inside your body? The truth behind sciatica and herniated discs. Sciatica isn't a disease. It's a symptom, a sign that your sciatic nerve, the longest nerve in your body, is being compressed or irritated. And in nearly 90% of cases, the culprit is a familiar one, a herniated disc. Picture your spine like a stack of sandwiches. Each vertebra is a slice of bread, and in between you have these soft, jelly-like cushions called discs. Over time, whether from injury, poor posture, or weak muscles, the soft center of the disc can bulge out and press on a nearby nerve root. The result? Pain that shoots from your lower back down your buttock leg, maybe all the way to your foot. Sometimes it even affects your ability to walk or control your leg. But here's the shocking part. A study from Harvard University found this. Not everyone with a herniated disc has pain, and not everyone with back pain has a herniated disc. What does that mean? It means the pain you feel might not be from a structural injury, but from the way your muscles, joints, and nerves have stopped working in harmony. The pain isn't just in your spine, it's in your lifestyle. You sit too much, move too little, so your back takes all the pressure. You stop stretching your hamstrings, so your lower back is pulled tight like a bowstring. You breathe shallow, sleep poorly, live under constant stress, so your muscles stay in a state of constant tension, like they're bracing for impact. All of this seemingly small things create a domino effect. And one day, your back gives out just from bending down to pick up your shoes. The good news, you can reverse it. Sciatica isn't a life sentence. You don't need surgery right away. And you definitely don't have to just live with it. Because the truth is, your body is built to heal, as long as you understand it and move in the right way. In this video, I'll walk you through 15 carefully chosen exercises, backed not just by my experience, but also by research from top institutions in the US, UK, Japan, and Germany. These are simple, low-impact movements. No gym, no fancy equipment, but powerful enough to reduce pressure on the sciatic nerve, support healing of herniated discs, strengthen your core, glutes, and thighs, improve circulation to your legs, and most importantly, give you back your freedom of movement. Ready to begin. Right now, we're about to start a 30-minute journey, not just to relieve pain, but to rebuild your strength, your confidence, and your trust in your body again. Because you deserve that. Not even though you're 50 or 60, but because you've lived long enough to know your health is the most precious thing you can choose every single day. Let's begin. The real reason your sciatica won't go away. Why that pain just won't leave you alone. Have you ever asked yourself, why is this pain still here? You've taken the meds. You've done the hot packs, the cold packs. You even gave yourself a week of rest, and yet the pain lingers. Like an uninvited guest, it just won't leave your body. People come into my clinic and ask me, Dr. Ethan, I've tried everything. Why does my back still hurt? Why is my leg still numb? And why every single morning do I wake up and struggle just to stand up straight? I look at them, smile gently, and say, maybe you've been treating the symptom, but not the root. You see, sciatica pain isn't just about a bulging disc or a nerve being pinched. It's often the result of something deeper. Years of forgetting to care for our body. Too much sitting. too little stretching. Mornings where we're in too much of a rush to spend 5 minutes warming up. Your core gets weak, your glutes shut off, and your lower back is left to carry the entire burden. We live in an age of comfort, but the cost of comfort is lost movement. We move less, and we hurt more. I remember a patient named Gloria, 68 years old. She was a retired elementary school teacher, energetic, always smiling, loved her afternoon walks. Then one year, after a long trip visiting family, she felt a little twinge in her lower back. At first it was just a mild ache. Then it started shooting down her right leg, burning numb heavy. Within 3 months, she couldn't walk 50 yards without stopping in pain. She got an MRI. The doctor told her it's a mild herniation. Just rest and it'll go away. So she rested, took the pills, cut back on walking. And the pain, it got worse. Because the human body, like a well-built machine, doesn't recover by sitting still. It rusts. Sometimes, we don't hurt because we're doing too much. We hurt because we've stopped doing enough. Not enough movement. Not enough muscle to support the spine. Not enough circulation to feed the nerves. Your body isn't betraying you. It's whispering to you. Come back. Let me move again the way I was meant to. The most important lesson I've learned in over 30 years as a doctor wasn't found in any medical textbook. It was in the eyes of my patients the moment they realized they could heal. Not with some miracle pill, but with 10 minutes a day of listening to their body and inviting it to move smarter and kinder. So how do you know what's really causing your sciatica pain? And more importantly, how do you choose the right exercise at the right time so you don't make it worse? In just a moment, I'll show you the 3 most common types of sciatica pain and the quiet messages your body is sending you every day. Because understanding that is the very first step to healing not just your back, but your whole life. 3. Types of sciatica pain and what they're telling you. Not all pain feels the same, and each kind is whispering something about your body. If you've ever struggled with sciatica, then you know it doesn't always feel the same. Sometimes it's a dull ache. Sometimes it burns like fire. Sometimes your leg just feels numb. And other times it's like an electric shock shooting down your body so sudden it takes your breath away. I once asked one of my patients, Jerry, age 74, Jerry, if you had to describe your pain, what would it feel like? He paused, squinted, and said, Doc, it's like someone plugged a power cord into my butt, and they flip the switch whenever they feel like it. We both laughed, but behind that laugh was a long road of frustration. The truth is, there are 3 main types of sciatica pain, and understanding which one you're dealing with can help you choose the right path to heal. Type 1. Dull achy. Radiating the body's first whisper. This one shows up as lower back discomfort, a bit of heaviness in the leg. You're still able to walk and go about your day, but something just feels off. This is often the early stage when the disc is just beginning to press on the nerve, but there's not yet major inflammation. It's your body's gentle way of saying, hey, I need a little attention. Let me ask you something. Have you ever brushed off a nagging backache, blamed it on sleeping funny, or dragged your feet around, never thinking, maybe this is my body trying to warn me? Type 2. Sharp pinpoint pain when the nerve starts speaking up. At this stage, the pain becomes more intense, like needles or fire running down one leg. It may shoot from the lower back into the hip thigh or down the calf, usually on one side. This is your nervous system ringing the alarm bell. We have a real problem here. I remember Linda, a 63-year-old teacher. She told me I was teaching, and suddenly my leg just gave out. I had to grab the desk to stop myself from falling. Turns out the L5 nerve root was under significant pressure. Luckily, she avoided surgery. With the right movement therapy and consistent practice, she was back in the classroom in just 3 months. Type 3. Numbness, weakness. Loss of control, the final red flag. This is the most serious stage. The nerve's been compressed for too long. The body starts losing signal. You feel your leg giving out. Your foot doesn't respond. Sometimes even bladder or bowel control becomes an issue. Have you ever had one leg that just wouldn't listen anymore? Had to stop mid-walk because your leg felt numb or limp? If so, that's not just discomfort. That's danger. The human body is fascinating. It never stays silent. First it whispers, then it speaks. And if we still don't listen, it screams. The small lesson I want to share with you today is this: don't wait until the pain forces you to stop to finally learn how to walk right. Once we reach our 50s or 60s, wisdom isn't just in the mind, it's in how deeply we understand and respect our bodies. So now that you understand what type of sciatica pain you're dealing with, what's the next step? Simple. We start in the safest, most comforting place, the 90-degree resting pose. It might seem like a simple position, but it's a gentle, powerful beginning to your healing journey. And right after this, I'll show you exactly how to do it, with care, kindness, and deep respect for your body's needs. The 90-degree resting pose. Start with healing, not pain. Let's begin with comfort, not by forcing ourselves through pain. You know, I've always believed the very first step in healing isn't about stretching or working out. It's about something even more basic: learning how to let the body rest the right way. Sounds simple, right? But after more than 3 decades as a doctor, I've come to a sad realization. Many people have forgotten how to truly relax. They lie down yet never feel rested. They try to sleep, but their bodies stay tense like a coiled spring. Have you ever lain down and still felt exhausted? That's a sign your nervous system is stuck in fight or flight mode when it should be in healing mode. For those dealing with sciatica, the traditional resting position can actually make things worse. Lying flat stretches the spine, strains the glutes, and increases pressure on the sciatic nerve. That's why I always start my patients with something simple, but incredibly powerful: the 90-degree resting pose, also known as legs up on a chair pose. Here's what you need: a flat surface like a bed or a mat on the floor, a sturdy chair just the right height, and a mind ready to pause. Lie flat on your back. Bend your knees and rest your calves on the chair. Your knees and hips should form a 90-degree angle. Arms relaxed by your sides. Close your eyes and breathe. Slowly, deeply. But why does this pose work so well? Because at 90 degrees, your lower back is decompressed. Your hip flexors can relax. Blood flow improves. And most importantly, the sciatic nerve finally gets a break. You're creating a space for healing instead of making your body endure more stress. I remember a gentleman named David, 70 years old. He used to work at a bank. When he first came to me, he couldn't sit for more than 10 minutes. The pain radiated from his lower back down to his knees. He said all he wanted was to lie down. But oddly, the more he rested, the worse he felt. Until we tried the 90-degree pose. At first it was just 3 minutes a day, then 5, then 10 minutes each morning. And after just 2 weeks, he told me he could get out of bed without wincing. But more than that, he said something I'll never forget. For the first time in months, I didn't feel like a patient anymore. You see, sometimes healing doesn't begin with effort. It begins with surrender. Think of a guitar string pulled too tight. You can't play beautiful music on it unless you loosen it first. The same is true for your body. It doesn't need you to fight the pain. It needs you to give it permission to let go, to breathe, to recover. So if you choose just one thing to begin with today, make it this resting pose. Morning, evening, whenever you feel overwhelmed, just 10 minutes. No sweat, no struggle, just you and your body, reconnecting in stillness. And once your body has been gently reset to a safe, calm place, then we'll begin to move again. Next, I'll guide you through 2 gentle exercises designed to wake up your core muscles, the very center of your strength and support. Let's step into the next part of your healing journey. Together, gentle core awakening, bird dog and bridging, done right. Reawakening your core The frame that once held you tall, now quietly dozing off. I once had a patient. His name was Frank, 65 years old. He used to work in HVAC installation, climbing ladders, lifting heavy units, crouching, twisting, always on the move. But after retirement, Frank started having lower back pain. It came on when he'd bend over to brush his beloved dog. He chuckled one day and said, "Doc, it's like someone took the frame out of my body. I feel wobbly weak, like there's nothing holding me up anymore." And I knew exactly what he meant. Because most lower back pain, especially sciatica, doesn't start where you feel it. It starts where you're no longer strong enough to support yourself. That place is your core. The deep muscles surrounding your spine, your belly, and your back. Your body's internal scaffolding. They keep you balanced. They steady you when you stand, walk, turn. They are the silent guardians of your movement. But the core muscles are also a little prideful. If you ignore them too long, they stop showing up for you. And when you finally need them, they're nowhere to be found. Now let me ask you, when your back hurts, what do you usually reach for first? Painkillers, a massage gun, a soft bed. Rarely do we think about reawakening the muscles that were meant to protect us all along. So, how long has it been since you truly activated your core? Let's start gently. With a simple move called the bird dog. Here's how it goes. Get on your hands and knees like a cat getting ready to walk. Then slowly extend your right arm and left leg out straight. Hold, breathe, then switch sides. No rush. This exercise isn't about performance. It's about sensation. Feeling your belly muscles engage to hold your balance, noticing your glutes fire to lift your leg, and sensing your spine. Slowly waking up. I always tell my patients, if you're shaking, that's okay. It means your body is waking up. After bird dog, we move on to bridging the bridge pose. Lie on your back. Bend your knees. Feet flat on the floor, about a hand's width from your hips. Now gently squeeze your glutes and lift your hips upward. Hold for 5 seconds, then lower slowly. A little tip. Don't overarch your back. Keep the movement smooth. Don't push with your thighs. Let your glutes do the work. This move doesn't just strengthen your backside. It helps improve blood flow to your lower spine, which is key for healing those damaged discs. I had a patient named Martha, 70 years old. She couldn't do much at first, but every morning she committed to just 10 bird dogs and 10 bridges. 6 weeks later, she was walking around her garden without her cane, and she told me, "I don't expect to be the way I was, but I know I'm on the right path, and I finally feel present in my own body again." You see, we often only pay attention to something when it starts to break, but your body doesn't need you to be perfect. It just needs you to return. One day at a time, one movement, one breath. Bird dog and bridging aren't just exercises. They're a quiet apology to your body for all the years we forgot it was there. And now that we've reawakened your core, it's time to release the nerve trapped deep in your hip. Coming up next, I'll guide you through a gentle stretch that can calm the pain radiating from your glutes down your leg. Just one simple movement, but it might unlock an entire region of relief within you. Unlock your hip, free the nerve. Piriformis stretch secrets. Sometimes that leg pain doesn't begin in your back, but in a tiny forgotten muscle deep inside your hip. There's something interesting most people don't realize. That burning tingling or numbing pain shooting down your leg, it's not always from your spine. Sometimes the real troublemaker is hiding in a place you'd never expect, a tiny muscle deep in your glute called the piriformis. Sounds fancy, doesn't it? But if you've ever had it act up, you know. There's nothing fancy about the pain it brings. The piriformis is a small triangle-shaped muscle tucked deep in your buttock, right above your sciatic nerve. And here's the kicker. For many people, the sciatic nerve either runs right through it or lies directly beside it. So when the piriformis gets tight, inflamed, or just stops moving well, it presses on the sciatic nerve, causing pain that feels almost identical to a disc herniation. We call this piriformis syndrome. Now, how can you tell if your sciatica pain is coming from your back or from this little muscle? Ask yourself, do you feel worse after sitting for long periods, especially on hard surfaces? Is the pain centered more in the buttock and only mildly runs down the leg? Do you feel a sharp pinpoint pain when lightly stretching your glute? If you nodded yes, you might not have a spinal issue, you might have a muscular one. And the good news, it's highly fixable if approached the right way. Let me tell you about Janet, 6 years old, a passionate oil painter. She once told me, "I can't sit long enough to finish a painting anymore. My left hip feels like someone's stabbing me." Her MRI came back clear. Spine looked fine. Discs were healthy, but the pain still very real. I checked her piriformis, and with just one simple stretch, she gasped. "That's it. That's the spot." We began a simple routine, just 2 gentle glute stretches a day. 3 weeks later, Janet sent me a handwritten note. I finally finished that canvas I'd left half done for 4 months, and I didn't have to get up once because of the pain. So now, let me teach you the same stretch I taught Janet and hundreds of others. How to do it. Lie on your back. Bend your right leg and cross the right ankle over your left knee. Then gently pull your left thigh toward your chest using both hands. You'll feel a deep stretch in your right glute. Hold for 20 to 30 seconds, breathe slowly, then switch sides. A few quick tips: don't strain your neck. Keep your body relaxed, no rocking or jerking. Just breathe and let your body slowly open up. And if lying down is too uncomfortable right now, you can do a seated version on a sturdy chair. It's a bit milder but still effective, especially if your pain is flaring up. You see, our bodies are full of places we often forget about. And only when they start screaming through pain do we remember, "Oh, I haven't paid attention to this part of me in a long time." The piriformis is just a tiny muscle, but when cared for properly, it can give you back a smoother walk and a night's sleep without tossing and turning from pain. And now that we've released the nerve, it's time to bring blood flow back to the legs, especially those feet that feel numb, cold, or achy after 50. Up next, I'll show you an incredibly simple move just by gently moving your ankles, but you'll be surprised how it unlocks your entire lower body. Let's keep going. Spine mobility and disc rehydration. Cat-cow and cobra. Explained. When you learn to breathe with your spine, healing begins from within. I often tell my patients, your spine is like a river. When it's flowing smoothly, flexible, and fluid, it brings life to everything it touches. But when it gets stuck stiff or motionless, that flow begins to dry up. Have you ever felt like your back is rusting? Every time you bend over or try to stand, there's that quiet little click and a dull ache that follows. If that sounds familiar, then today we're going to oil that spine back to life with movements so simple, yet so powerful for healing. But first, here's something most people don't know. Your discs don't have blood vessels. They don't get nourishment the way muscles or bones do. Instead, movement is the only way your discs eat and drink. Every time you take a deep breath, extend your spine, or gently bend, you're allowing nutrient-rich fluid to soak into those discs and rehydrate them. And when you sit too long, stay still, or avoid movement, your discs start to dry out like a sponge left out in the sun. So let me ask you, how many minutes today have you given your spine the chance to breathe? Not through your lungs, but through movement, slow, rhythmic, relaxed, and intentional. Let's bring it back to life with 2 gentle movements. 1. Cat-cow. Wake up each vertebra. We'll begin with a soft, flowing motion cat-cow. Start on your hands and knees like you're about to crawl. As you inhale, drop your belly down. Lift your tailbone, raise your head, just like a peaceful cow grazing in the field. As you exhale, round your back upward, tuck your chin, and draw your belly in like an angry cat stretching. Keep moving with your breath, slowly. No tension, no forcing. Let each vertebra remember what it's like to move. 2. Cobra pose, releasing the discs. Next, we move into the cobra. Lie on your stomach. Place your hands next to your chest. Now gently push your upper body up while keeping your hips and lower belly on the floor. You don't need to lift too high, just enough to feel a soft opening in your lower back. This movement is amazing for gently nudging herniated discs back into place, especially in the early stages. But listen to your body. If it hurts, stop at the first spot that feels comfortable. Sometimes just lifting a few inches is more than enough. I remember Mr. Leonard, 72, an avid golfer. He told me once, "Doc, I can drive the ball 100 yards, but I can't bend down to tie my shoes without feeling like my back's going to snap." So we started with 5 minutes of cat-cow each morning and 3 rounds of cobra every evening. 1 month later, not only was he tying his shoes, he was back on the golf course swinging smoother than he had in years. He told me, "My back doesn't feel older anymore. It feels like it's coming alive again." There are some movements that won't make you sweat. They won't tire your muscles, but they replenish the parts of you that have quietly dried up over the years. Cat-cow and cobra aren't just stretches. They're your way of making peace with a spine that has quietly carried your life for decades. They're like a gentle apology offered to the vertebrae you forgot to thank. And now that we've reawakened the spine and opened up that inner river of nourishment, it's time to move to another area that's often ignored: your hamstrings, the bridge between your legs and your lower back. Up next, I'll show you a simple stretch using nothing more than a towel. But it could be the one thing that helps take real pressure off your back naturally and gently. Let's keep going. Dear friend, if you've stayed with me all the way to the end of this video, then I truly believe something. You're no longer just a viewer. You're someone who's beginning to reconnect with your own body, who's listening, and who's stepping into a healing journey with intention and with love. If this video helped you understand your pain more clearly and opened a gentle, natural path toward recovery, then please share it with someone you care about, someone who might be silently struggling, unsure of where to start. And don't forget to hit that subscribe button so you won't miss the next videos, where I'll continue to guide you step by step through simple movements and mindful breathing to help you reclaim the freedom and ease your body truly deserves. I'll see you in the next video. There's so much more ahead of us, and I'm honored to walk this path with you. Let me know if you'd like a shorter version for YouTube Shorts or one formatted as an end screen voiceover.